Wisconsin Governor Tony Evers has signed a COVID relief bill into law. This came after a couple of attempts to get something through the Wisconsin legislature. Evers had submitted two separate, very comprehensive proposals to the Wisconsin legislature as early as the middle of March to try to get some federal relief to the state of Wisconsin during this national emergency. Well, both of those prior legislative packages were refused by the legislature. But in the meantime, the legislature has finally come together and crafted a new bill. And in the first ever virtual session, the Assembly met first and approved that measure 97-2. The bill then went to the Wisconsin Senate, where it was unanimously approved. Governor Evers penned a letter to the legislature asking that it be delivered to his desk very promptly so he could sign it into law. And he did that on April 15th, creating 2019 Wisconsin Act 185, the COVID relief bill for the state of Wisconsin. Now, we needed to do this quickly because we were running out of time to take advantage of some federal aid that could come into the state of Wisconsin to the tune of about $2 billion. This would be money that would help enhance our state Medicaid program and make sure we could continue to do some testing and treatment for the people in the state that are impacted by the coronavirus. Wisconsin's Department of Health Services had been seeking permission to get different waivers and federal permissions and enhanced FMAP. Now that's that federal share of our Medicaid program that was being offered by the federal government. We needed the Wisconsin legislature to approve that request before it could be submitted. And now we have that. There was also other language that was included in this relief bill that went through Wisconsin, including a ban on certain insurers from prohibiting coverage based on COVID diagnosis. It also included some temporary permission for the Department of Health Services to request other types of Medicaid waivers, those 1135 or Appendix K waivers that we've talked about in different videos. There also was the removal of the 1 week waiting period for unemployment benefits, something that was bipartisan and a lot of people had been asking for. But there were also a couple other items tucked into this bill, as often happens. Now, there was a Republican measure earlier in the year to change certified nursing assistant training requirements. That hadn't passed in a prior session, but it was included in this bill, and that did get signed into law as well. Not included, that Governor Tony Evers had asked for, was additional money for frontline workers, for public health, for small business, and for farmers. So this was definitely a compromise bill. There was a lot of money that would have gone to state and local public health departments that was not included in this final version. So Governor Evers, when he did sign the bill, said, "My pen has been waiting for weeks," it's fair to say over a month, to capture our fair share of the federal dollars coming through the CARES Act. And he does acknowledge that this bill is a step in the right direction, but that there's much more work that needs to be done, especially if we want to get a little bit more of that relief for farmers, for frontline workers, and for public health. You can read a copy of Wisconsin Act 185. We link to it in the description below.